My name is Simon Ray and I'm the President of the British Cardiovascular Society. I've been a cardiologist at Wythenshawe Hospital in Manchester for a little over 25 years. For the last year or so, I've done a talk on a course organised by the BJCA called The Final Straight. This is aimed at trainees approaching the point of consultant appointment, and one of the concepts that I try and get across on this course is that the job that you're appointed to on day one as a cardiologist is not going to be the job that you do for most of the rest of your career. And this reflects the very rapid pace of change within cardiology as a specialty, which I think it's true to say has been simply astonishing over the last 10 to 20 years. Now, all of this, of course, has been thrown into stark relief by the events of the last 2 to 3 months and the COVID epidemic. And the pace of change, the pace of adaptation, not just in cardiology but across the whole NHS, has been simply breathtaking. And I think if we were looking forward now from the perspective of January or February this year, many of the changes in the service that we provide, many of us would feel that those are simply unachievable. And I think it's a huge credit to the NHS as a whole that we have managed to adapt so quickly. I'm sitting here in outpatients. I've just finished a clinic. It was a phone clinic. This is a bit of a learning curve for me, as it was for the patients, and I think probably for many of you. It's not for everybody, but the majority of the patients that I've seen virtually feel that it is a positive experience. On a normal clinic morning out there in the waiting room, there are probably 100, 110 people going through in the morning, and despite the efforts of some very attentive staff and a decent physical environment, some of those patients do wait a long time to be seen, and it isn't necessarily a positive experience for all. And I think this is one example of where the changes that have been thrust upon us by COVID can be utilised to improve patient experience in the future and to redesign cardiology such that it has a genuine patient-centred focus that has not been possible previously for a large number of reasons. As I speak, cardiology services around the country are beginning to reopen. It is very important as this happens that we keep a clear focus on safety, and that is the safety both of staff and of patients. One of the issues which is going to come up again in the next few weeks is the availability and use of PPE. This is something that we're quite concerned about at the BCS, and we're putting out a survey which will appear on the website and will come out via email. And I'd be very grateful if you could take a few minutes of your time to complete the survey with your views on the use of PPE in cardiology practice and return it, because this will inform the BCS position and, most importantly, inform our interactions with NHS England and other bodies. It is also important that we keep a focus on the safety of our patients. We owe it to our patients that the environment in which they're seen or admitted carries the lowest possible risk of infection. Otherwise, there is a significant risk that people will continue to stay away from hospital with long-term consequences for their health. As I've already mentioned, the changes in outpatients are one example of where innovation forced on us by COVID may be beneficial. I think there are lots of others, and in order to try and capture these, I've set up a working group within the BCS on the future of cardiology. If you have any innovations that have been carried out in your own trust or your own network, your own locality, I'd be very interested in hearing from you. We've got a very straightforward email address, futurecardiology@bcs.com, and the working group will collate all the suggestions that we get in and will publish a report towards the end of June or beginning of July that we will hope will inform the future practice of cardiology. To end, I think it is important to emphasise, as other colleagues have on previous versions of this Talking Head series, that cardiology is delivered in teams. And as you'll all be aware, there are members of heart teams around the country who, by virtue of the nature of the work that they do, are continuing to put themselves at some degree of risk of infection with COVID. It is more important than ever at this time that we look out for the other members of our heart teams. And so, to all of you who are listening, Please look out for the interests of your colleagues in the very difficult circumstances that are still going to continue for the next few weeks. Thank you for listening.